A medical thriller-style caption. A woman goes in for a simple appendix removal surgery, but when she wakes up she feels unusual. While a nurse helps her, the nurse apologizes, saying she didn't realize her husband hadn't told her something. When the woman demands to know, the nurse whispers that her husband had secretly approved a second surgery she never consented to. The text highlights the shocking phrase, "one you never consented to." The fluorescent lights buzzed faintly above Emily Carter's head as the hospital corridor stretched out before her like a calm, sterile tunnel. The walls were the same soft beige she had seen during her volunteer years in college, an oddly comforting familiarity in the middle of her mild anxiety. She held Daniel's hand, their fingers interlocked tightly. Her husband, Dr. Daniel Carter, had worked at St. Grace Memorial for over 7 years. He was one of the most respected resident physicians in general surgery. Everyone seemed to know him, and by extension, they knew her too. "Appendectomy is one of the simplest procedures we do here," he had told her over breakfast the day before, brushing a lock of her dark brown hair behind her ear. "You'll be out and home in 2 days, tops." So why was her heart racing? They stopped in front of room 407. A nurse smiled warmly at her. "Good morning, Mrs. Carter. We've been expecting you. I'm Leah. I'll be with you until you're prepped for the OR." Emily returned the smile, her lips tight. "Thanks." She changed into the hospital gown behind a curtain and climbed into the bed, the crisp sheets cool against her skin. Daniel hovered close, his hand never leaving hers. He whispered reassurances between short updates, translating medical jargon into soft, loving promises. "All set?" Leah asked gently. Emily nodded, trying to steady her breathing. The 4 was placed swiftly. Vitals checked. Another nurse wheeled in a cart with anesthesia equipment. Soon, the anesthesiologist arrived, a tall man with quiet eyes and a steady voice. "This will feel cold," he said, injecting the sedative into her 4. Daniel leaned down, kissing her forehead. "I'll be right there. I'll see you when you wake up, Em." Her last memory before the darkness was his voice, low and certain, "You're safe." She drifted into unconsciousness. The surgery itself was supposed to last under an hour. A laparoscopic appendectomy, 3 tiny incisions, a quick camera-guided removal, and back to recovery. Daniel had walked her through it multiple times, even showing her diagrams and videos to ease her nerves. She trusted him. Not only because he was a doctor, but because he was her husband, the person who had stood by her through her endometriosis treatments, her miscarriages, her hopes, her pain. There were complications, minor ones. A slight delay due to the schedule running late. Daniel excused himself to check on a patient in the ER. According to hospital policy, he wasn't allowed to operate on a family member, but he could be present. And he was, at first. Dr. Warren, the chief of surgery, had stepped in as the lead. Experienced, meticulous, and a firm believer in aggressive preventative care, Warren had taught Daniel most of what he knew. In the operating room, the atmosphere remained focused and clinical. Emily lay unconscious under the sterile lights, her vitals stable, her body unmoving except for the rise and fall of her chest beneath the oxygen mask. The surgical team moved with practiced precision. The appendix was removed within the first 30 minutes, just as expected. Then came a pause. A quiet conversation. A document. A nurse glancing at the screen, hesitating before nodding. It lasted only 13 more minutes. No one in the waiting area suspected anything was out of the ordinary. Daniel had gone to grab coffee when he received the text, "Procedure successful. Recovery in 30. He didn't return to the surgical wing immediately. Instead, he sat in the hospital garden, watching bees hover over overgrown lavender bushes, his fingers trembling slightly around his cup. Emily was wheeled into recovery. The nurses were courteous. Efficient. By the time she stirred, groggy from the drugs, night had already fallen. The room was dim, lit only by the monitor glow and a small lamp near her bed. Daniel returned shortly after, kissing her forehead again. "Everything went well," he whispered. "You did great, She tried to speak, her throat dry. Hurts more than I thought. That's normal. Some people feel more soreness, especially if there was inflammation. I'm here, okay? She nodded, fading in and out of sleep. Outside her room, Nurse Leah lingered longer than she should have. She stared at the monitor's digital chart for room 407. Her fingers hovered over the touch screen. Twice, she opened the file. Twice, she closed it without making changes. There was an unusual timestamp. A digital signature added mid-procedure. She knew what that meant. Down the hallway, Dr. Warren removed his gloves, tossing them into the biohazard bin with practiced ease. He washed his hands slowly, meticulously, eyes trained on his own reflection. He had done what he believed was necessary. What had been authorized. He wasn't the villain. He was the surgeon. He made decisions for patients all the time. And sometimes, husbands made them too. Emily slept through the night, unaware of the decision made in her name. A decision she never discussed, never debated, never imagined would even be on the table. Her body was sore, her abdomen wrapped in thick bandages that hid more than she realized. But she would learn. And when she did, the pain would be far deeper than any scalpel could ever cut. She would remember the way they smiled at her. The way they said, "It's just routine." The way they made her feel safe. Because what had happened wasn't routine. It was something else entirely. Something she never consented to. Emily woke slowly, as though surfacing from beneath a thick layer of fog. Her throat felt dry, her mouth cottony, and there was a dull throb in her lower abdomen. She blinked against the dim light of the hospital room, her eyes adjusting slowly. For a moment, she was unsure where she was. The clean scent of antiseptic, the low beeping of monitors, and the cool air told her before memory did. The surgery. The appendectomy. A soft chime rang as the monitor registered her awakening. A nurse entered a few seconds later, walking briskly but with an air of caution, as if she had been waiting nearby for this exact moment. "Mrs. Carter," she said, checking the 4-line. "You're awake. That's good. Everything went smoothly. Just relax and let yourself rest." Emily tried to speak but her voice came out in a whisper. "Water." The nurse reached for a small pitcher and poured water into a plastic cup, guiding the straw to her lips. Emily sipped slowly. As the dryness eased, a new sensation set in, an unfamiliar tightness across her lower belly. She shifted slightly under the blanket, and the discomfort sharpened. Her fingers drifted downward, grazing the edge of the bandages wrapped around her abdomen. She froze. There were more bandages than she expected. Not just around the lower right side, where she assumed the laparoscopic incisions would be, but also across her midsection in a way that didn't make sense. Her heart picked up pace. The nurse noticed. "You're going to be sore for a little while, but the pain meds are scheduled. Let me know when you feel anything more than mild discomfort." Emily looked at her carefully. The nurse was kind, her tone gentle, but there was a stiffness in the way she moved, a hesitation in her eyes when they met Emily's. Something wasn't right. What's this?" Emily asked, her voice still weak as she gestured toward her abdomen. "The bandages." The nurse paused for half a second, just long enough to be noticed, then smiled quickly, covering it with practiced ease. "It's just post-op dressing. Normal for recovery." Emily's brows drew together. "But this isn't the way they said it would be. I saw the videos. Laparoscopic, it's just 3 small cuts, right?" The nurse busied herself with the 4 again, not looking directly at her. "Sometimes, depending on the case, adjustments are made. Every body responds differently. But you're okay. Just rest for now." She turned to leave, but Emily wasn't ready to let it go. "Wait. Can I see my husband?" The nurse hesitated again. "Dr. Carter is in surgery. He's been tied up with a critical patient since this morning. I'll let him know you're awake." As she stepped out of the room, Emily caught something in her expression. It wasn't just professional detachment. It was discomfort. A kind of emotional flinch. Like she had just walked away from something too heavy to carry. Emily stared at the ceiling, trying to make sense of it all. Pain prickled in her stomach again, sharper now. She reached under the blanket, gently lifting the hem of the hospital gown. Her breath caught. The bandages ran farther than she had expected, centered more toward the middle of her abdomen. Not just to the right where the appendix should have been. Something was off. She pulled her hand back quickly, suddenly nauseated. She pressed the call button. When no one came after several minutes, she pressed it again, more urgently. A different nurse eventually arrived, this one younger, more formal, barely meeting her eyes. "Can I help you, Mrs. Carter?" Emily licked her lips. "Can someone tell me exactly what was done to me?" The nurse's face gave nothing away. "You had an appendectomy. The details of the procedure are in your chart. Your physician will review it with you soon. I want to see it myself." "The chart? I'm afraid I can't authorize that. But your care team will. I'm a patient." "It's my body," Emily snapped, more forcefully than she intended. "I have the right to know what was done." The nurse nodded, clearly uncomfortable, and left with a promise to notify the attending. Emily slumped back into the pillows, her head spinning. The pain, the strange reactions, the bandages, they weren't adding up. And where the hell was Daniel? She drifted in and out of sleep, drugged by whatever pain medication they'd given her. Each time she woke, her sense of unease deepened. By late afternoon, the shadows in the room had stretched, and Daniel still hadn't come. Instead, a different doctor, a short, wiry man with graying temples, entered her room with a clipboard in hand. "Mrs. Carter. I'm Dr. Myers. I was part of the team monitoring your vitals during surgery. Just here to check in on your recovery." Emily sat up slightly, pain making her wince. "Can you tell me what happened during the surgery?" He paused, then smiled in a way that felt too smooth. "Your vitals remained stable. The surgery proceeded without incident. You're healing well." "That's not what I asked." Her voice was steady now, clear. "I want to know exactly what was done." He flipped through his notes, his eyes scanning quickly. "We removed the appendix as scheduled. Some additional tissue around the area showed signs of inflammation, so the team decided on a minor extension of the procedure to ensure there was no residual infection." "What kind of tissue?" He looked up, hesitating just enough. "It's all in the report. But really, it's nothing you need to be worried about." Emily narrowed her eyes. "Nothing I need to be worried about? This is my body." Dr. Myers cleared his throat. "Your husband will go over everything in detail when he's available. He's been briefed. So he knows more than I do?" Another pause. "Yes. As your emergency contact and medical proxy during the procedure, he was informed." Emily's stomach turned. She hadn't signed any additional forms. No one had mentioned anything beyond the appendectomy. Her hands clenched into fists beneath the blanket. "I didn't consent to anything else," she said quietly. "There was no time, no conversation. Just the appendix. That's all I agreed to." Dr. Myers offered another empty smile. "I'm sure everything was handled appropriately. Try to rest." He left before she could say another word. Alone again, Emily stared at the door, fury building slowly in her chest. Her mind ran through every possibility, every reason why Daniel would authorize something behind her back. But nothing made sense. Nothing justified this silence, this deceit. She turned toward the monitor beside her bed. A small panel displayed her vitals, medications, and a button marked Patient Access. She tapped it. A login screen appeared. She entered her patient ID, the one she remembered from the intake form. A loading symbol spun for several seconds before opening her dashboard. There, under Surgical History, were 2 procedures listed. 1. Laparoscopic appendectomy, completed. 2. Laparoscopic bilateral salpingectomy, completed. Her eyes stopped on the second line. She didn't recognize the term fully, but the word salpingectomy chilled her. She tapped it. A brief description loaded. Removal of both fallopian tubes for sterilization or preventative oncology. Her heart stopped. She stared at the screen, disbelief washing over her in waves. They hadn't just taken her appendix. They had sterilized her. Without telling her. Without asking. Without permission. A sharp, cold nausea spread through her stomach, threatening to consume her. She reached for the call button again, hand trembling. Then stopped. What would they say now? What lies would they feed her this time? The only thing she knew for sure was this. Something terrible had been done to her. And someone had to pay for it. The next morning came slowly, dragging with it the heavy ache of a night spent in restless, fragmented sleep. Emily hadn't cried, not yet. The shock was too thick, too absolute. It wrapped around her chest like a weight she couldn't dislodge, like the air itself was complicit in what had been done. She didn't press the call button again. She didn't ask for her husband. She sat upright in bed, one hand resting protectively over the thick gauze on her abdomen, the other gripping her phone. She had spent the early hours searching the term bilateral salpingectomy, clicking through endless articles with surgical diagrams and legal threads. The more she read, the colder she became. Not because of the content, but because of the growing certainty that it hadn't been a mistake. It had been a choice. And not hers. She was scanning through a medical forum, reading about legal requirements for consent in reproductive surgeries, when the door creaked open. It was Leah, the nurse from before. The one who had been kind. The one who had paused. Emily didn't look up right away. She waited until she felt Leah move closer, until the sound of gloves being adjusted and machines being checked filled the space between them. "You're back," Emily said, her voice low but calm. Leah hesitated. "Just for the morning shift." Emily nodded once, then set her phone on the table. "Can I ask you something?" Leah glanced at her, then at the closed door, before giving a cautious nod. "Of course. What exactly happened during my surgery?" There was silence. The faint hiss of the oxygen machine, the quiet beeping of her heart rate monitor, the soft hum of the hospital air vents, everything seemed to stretch in that pause. Then Leah straightened, smoothing her uniform. "You had an appendectomy," she began, almost reflexively. "I've already read the chart," Emily interrupted. "I know about the second procedure. The salpingectomy." Leah stopped moving. Emily met her eyes, firm and unwavering. "I want to know when that was added. And who authorized it." The nurse's throat bobbed as she swallowed. She looked away, her gaze falling to the floor. "I'm not allowed to." "I'm not asking for legal permission," Emily said. "I'm asking as someone who just woke up without part of her reproductive system. I think that warrants a real answer." Leah glanced toward the door again, then stepped slightly closer, lowering her voice. "I shouldn't say anything. I could lose my job." "You're not the one who did it," Emily said. "You were there. That's all I'm asking about." Leah stood still for another moment, weighing the silence. Then, slowly, she spoke. There was a moment, right before the incision. A note was added to the surgical plan. It came through the system about 20 minutes after the original procedure had already started being prepped. It was flagged as urgent. Emily's pulse spiked. "And that's when the second surgery was approved?" Leah nodded faintly. "It wasn't there before. I double-checked because it seemed strange. But the surgeon just said, 'We have consent. It's been added. Move forward.'" "Who gave that consent?" Emily asked. "I assumed it was you," Leah replied, almost whispering now. "Until after. When you woke up confused, and then asked me about the bandages." Emily leaned forward slightly, ignoring the pain. And you said something. Leah froze. You said, he should have told you. You meant Daniel. Leah blinked, clearly shaken. I didn't mean to, I thought you knew. I didn't, Emily said. Her voice remained calm, but underneath it trembled a storm. I didn't know anything. Leah looked at her, guilt etched across her features. It shouldn't have happened like that. It's not how things are supposed to work. Consent is non-negotiable. Then why did it happen? Emily asked, her voice cracking just slightly. Leah looked toward the hallway. She stepped closer to the bed, glancing again to make sure the door was still closed. Then, carefully, she said, because your husband is a doctor here. And Dr. Warren doesn't question his own. If a physician says it's preventive, and there's a digital signature, the system accepts it. Emily stared at her, the words burning into her chest. So he signed off on it? I don't know the name on the order, Leah admitted. But it wasn't your signature. Emily's throat tightened. Can you show me? The record? Leah looked torn, her fingers twitching slightly against the bed rail. They've probably locked it down by now. Access is restricted once there's a question of consent. But I remember the timestamp. It was inserted at 7:21 in the morning. Just minutes before they took you in. Emily's mind reeled. Her surgery had been scheduled for 7 o'clock. She'd been under anesthesia by 7:15. Whoever entered that order had done it while she was unconscious. Thank you, she said, her voice firm but raw. Leah gave a short nod, then stepped back. You didn't hear any of that from me. I didn't, Emily agreed. The nurse left quickly, and the silence that followed felt more suffocating than before. Emily reached for her phone again, heart pounding in her ears. She opened the hospital's patient app and scrolled to the document section. As expected, most of the files now showed a locked icon, requiring administrative clearance. But she still had the photo she had taken of the screen the night before. The procedure codes. The descriptions. The proof. She opened her messages and tapped out a name, Julia Langston. Her best friend since college. Now a civil rights attorney in San Diego. Emily hadn't talked to her in over a year, but right now, she didn't care. She typed quickly. Something happened during my surgery. I didn't consent. I need legal advice. Please call me as soon as you get this. She hit send, then added the photo of the chart. She was still staring at the screen when the door opened again. It was Daniel. He stood in his scrubs, his hair slightly tousled, his eyes tired. He offered a soft smile, as though this was just another morning, just another recovery. Hey, he said gently. You're awake. Emily didn't respond. She watched him cross the room, watched him hesitate when he saw her expression, watched his features shift, just barely, as he sensed the storm waiting for him. I tried to come by earlier, he said, stopping at the foot of her bed. They had me in a back-to-back case load. She didn't move. When were you going to tell me? Daniel froze. She lifted the phone slightly, showing him the screen. The words, bilateral salpingectomy, stared back at him in silent accusation. His face drained of color. You knew, she said. You authorized it. Without asking me. Without telling me. Daniel took a slow step forward. Emily, it wasn't like that. Then explain it to me, she snapped, her voice rising. Explain how I went in to remove my appendix and woke up sterilized. Daniel looked like he was grasping for words. It was a medical judgment. There were risk factors, your history with endometriosis, the scarring, the reproductive strain. Dr. Warren and I agreed. You agreed, she repeated. Did I agree? Did I say yes? He fell silent. Emily's eyes were blazing now. How could you do this to me? I thought I was protecting you, he said quietly. You've been in pain for so long. Every month. Every cycle. Every miscarriage. This wasn't your choice, she cut in. You took something from me. Something you had no right to take. Daniel stepped closer, reaching for her hand. Emily, I love you. I didn't want to see you suffer anymore. She pulled her hand away. I want you to leave, she said. Her voice was shaking, but her words were clear. Get out. Daniel opened his mouth to speak, but she turned her face toward the window, refusing to meet his eyes. After a long pause, he left. And when the door closed, Emily let out a breath she hadn't realized she was holding. She was no longer confused. Now she was furious. The minutes after Daniel left stretched endlessly. Emily sat motionless, her body upright but trembling just beneath the surface. Her skin felt cold, yet her pulse raged. The pain in her abdomen had dulled into a distant throb, but the wound inside her was raw and jagged. No medication would soothe that. She stared blankly at the wall across from her bed. Her phone buzzed on the tray table next to her. She blinked, slowly turned, and saw the screen light up. Julia Langston, incoming call. With a swipe of her thumb, she answered, pressing the phone to her ear. Emily? Julia's voice was firm, urgent. What the hell is going on? I need help, Emily whispered. I read your message. And the photo. Jesus, Em. That's not a mistake. That's a violation. Tears threatened for the first time, but Emily blinked them back. He signed off on it. Daniel. While I was already under. He told them it was preventative. For my own good. There was a silence on the other end. Then Julia asked, do you have anything in writing? Only the screenshot of the chart. The app's locked now. But a nurse told me the second procedure was added minutes before the operation. Not by me. It was flagged as urgent. Julia exhaled audibly. That's manipulation. And it sounds like the hospital is trying to bury it. Do you know who approved the final order? No. But I can guess. You don't need to guess. You need the file. Get your discharge scheduled as soon as possible. The longer you stay there, the more control they have over access. You'll need an independent physician to assess your condition post-op and verify what was done. And we need every single record, anesthesia logs, internal communications, everything. Emily nodded, even though Julia couldn't see her. Okay. I'm coming there. Tonight, Julia added. I'll get a hotel near the hospital. Don't sign anything. Don't let Daniel near you. And if anyone else tries to talk you into clarifying your consent, you call me immediately. Got it? Got it. They hung up. The call had lasted 3 minutes. Emily felt like she had aged 10 years in that time. She pressed the call button again, her mind now moving quickly, not from emotion but survival. A nurse responded, a young man she hadn't seen before. He entered politely, clipboard in hand, smiling like nothing was wrong. I'd like to be discharged, she said. Today. The nurse blinked. Oh, well, let me check your file. Usually post-op patients stay at least. I'm not staying another night in this hospital. He hesitated. I'll notify your care team. Thank you. He left. She reached for her small overnight bag, which sat in the cabinet under the window. Her hands moved slowly, methodically. She found her charger, plugged it in. Then she slid her phone into airplane mode. It felt paranoid, but necessary. She didn't know who might be accessing her data anymore. She didn't trust anyone in this building. Her stomach twisted again, and she clutched at the blanket. Not from physical pain this time, but a deeper instinct, an invisible thread unraveling inside her. This place felt hostile now. Not just indifferent, but dangerous. More hours passed. Afternoon shadows crept across the floor. No one returned. No doctor. No Daniel. No update on her discharge. At 4:30, her door finally opened again. It was Dr. Warren. He entered without knocking, calm and authoritative, his white coat pristine, clipboard in hand. His smile was professional, but cold. "Mrs. Carter," he said. "I thought it might be a good time to check in." Emily didn't reply. He walked closer, glancing at her monitors. "Vitals look good. How's the discomfort?" She stared at him. "I'll assume tolerable, then," he added. "You approved it," she said, her voice flat. Dr. Warren paused just slightly, then resumed flipping through pages. "I understand you've had some questions about the procedure. I want to see the consent form. The one with my signature on it." He stopped flipping. "As I'm sure you understand, emergencies require quick decisions," he said slowly. "Your medical history." "I didn't ask for a speech," she snapped. "I asked for the document." Dr. Warren's face hardened a little. "That form is not part of the general patient portal, but it can be accessed through hospital administration." "So you don't have it," she said. He set the clipboard down on the tray table. "Your husband authorized the secondary procedure under delegated consent. As both your spouse and a physician on staff, That doesn't make it legal." Dr. Warren offered a tight smile. "We'll let the legal department determine that. In the meantime, I recommend staying under observation. Rushing out of here could put your recovery at risk." "I want to leave," she said again. "Today. I can't authorize that without clearance from your attending." "Then get my attending." His smile faded completely now. "You're making this more difficult than it needs to be, Mrs. Carter. And you're lying to a patient," she said, meeting his eyes. "You performed a surgery on a conscious, informed adult woman without her consent. And you're about to find out what that costs." For a moment, neither of them moved. Then he picked up his clipboard and turned toward the door. "I'll inform the discharge team," he said quietly. "But I strongly advise against further action until you've had time to fully process what was done." Emily didn't reply. She watched him leave, watched the door click softly shut, and felt something shift in her chest. Not fear. Not confusion. Resolve. By 6 o'clock, she was changed into her own clothes, painfully, slowly, every movement tight and aching. The discharge nurse brought the paperwork, avoiding eye contact. Emily signed nothing except the standard release. No waivers. No agreements. Daniel didn't come. She walked out of the hospital on her own, holding onto the railing as she descended the steps. Julia was waiting at the curb, engine running. When Emily opened the car door and sank into the passenger seat, she didn't speak right away. Julia reached over and placed a hand gently on hers. "Let's get you out of here," she said. They pulled away from the hospital, the building growing smaller in the rearview mirror, the sun dipping low behind it. Emily closed her eyes, exhaled slowly. She wasn't safe yet. But she was out. The hotel room was quiet, its atmosphere sterile in a way Emily found both familiar and oddly comforting. The silence was not charged like the hospital's, but still it pressed in around her, every breath reminding her that her body had changed in a way she hadn't chosen. She sat propped up against a stack of white pillows, the soft cotton of her loose t-shirt hiding the bandages beneath. A dull pain lingered, but the real discomfort was in her mind, which refused to settle. Julia paced at the foot of the bed, her phone pressed to her ear, voice sharp and measured. "No. We don't need assumptions. I need a copy of the original or schedule and the surgical amendment logs. Not summaries, raw entries. Timestamps. And I want the anesthesia records too." Emily stared at her own phone, which rested on the side table. She hadn't opened her texts. Several were from Daniel. The notifications glowed on the screen like a wound left untended. She knew what they'd say, apologies masked as justifications, concern laced with control. She couldn't read them yet. Julia ended the call and turned. "The hospital's stonewalling. Claims your full chart is under internal review. which means they're buying time to scrub whatever they can. I have the photo, Emily said softly. The one from before they locked the app. It's a start. But it won't be enough in court without metadata. We'll need to prove it wasn't altered later. Julia grabbed her laptop from the desk and brought it over. And if we're going to fight this, we need to map out their digital trail. That means breaking through the firewall on your patient record, or finding someone who already has. Emily blinked. You mean hacking? I mean finding a way in through legal or quasi-legal channels, Julia said without hesitation. If they modified your chart after the fact, we'll see the audit logs. Every entry has a user tag. They can hide content, but they can't delete the digital footprints. Not entirely. Emily hesitated. There's someone I know. IT. She works nights at the hospital. We met through Daniel. Her name's Cass. She owed me a favor once. Good, Julia said. Call her. Don't explain everything. Just say you're looking for a timestamp on a medical order and you need her to check the history. Keep it simple. If she asks questions, let her think it's about a billing error. Emily picked up her phone and scrolled through her contacts. Cass's number was still there. She tapped it, heart racing as the call rang once, twice, 3 times. Hello? Cass. It's Emily Carter. A pause. Emily. Hey. I heard you were in the hospital. Everything okay? There it was. The edge in her voice, the careful neutrality. Emily knew better than to rush. Not really, she said. Something's off in my file. I took a screenshot of my procedure list, but now the app's locked. I need a quick check, just to see when a note was added. I think it messed with my insurance. Cass hesitated. Emily, you know I'm not supposed to. I'm not asking you to pull anything illegal. Just the metadata. A timestamp. It's just one note. I'll send the screenshot. Please. Another pause. Then, text it to me. I'll see what I can do. Emily hung up and forwarded the image immediately. She turned to Julia. She didn't say no. Julia nodded. That's promising. They waited. The minutes dragged. Outside the window, the city began to darken, streetlights flickering on one by one. At 8:43, Emily's phone lit up. Cass, there's definitely a secondary entry. Added 7:21 a.m., same day. Or schedule updated by a delegated user account, d.carter.proxy. It overrides your digital consent form. Original consent only lists appendectomy. That's been archived now, hidden but not deleted. Want the screenshot? Emily felt her chest tighten. He used a proxy login. That's why it looked authorized. Julia took the phone, reading the message twice. That's your proof. He impersonated a legal delegate entry. But the system still logged his name. That's traceable. Emily replied, yes. Please send everything you can. Moments later, a set of attachments arrived. The updated schedule. The digital consent override. The access logs with the user account ID. It was all there, enough to build a case, or at the very least, bring the truth into the open. I want the original too, Emily said quietly. The real consent form. The one I signed. And the one I didn't. We'll get it, Julia said. But we'll have to be careful. Now that they know you're out and asking questions, they'll start closing every door. Emily leaned back against the pillows. What happens if they delete the files? They won't, Julia said. Too risky. In malpractice cases, digital evidence destruction is worse than the offense itself. Hospitals know that. They'll hide it, delay it, blame a system error, but they won't erase it. There was a knock on the door. Emily froze. Julia moved quickly, walking over and checking the peephole. It's Daniel, she said. Emily didn't speak. Do you want me to? Don't open it. He knocked again, louder this time. Emily, it's me. Please. Julia stepped back from the door. He doesn't know I'm here. Good. Another knock. A pause. Then footsteps retreating down the hallway. Julia returned to the bed. You ready for the next step? Emily exhaled slowly. What's the next step? We file a formal request to preserve all digital logs associated with your patient ID. We do it through a lawyer, so they're legally bound to retain the data. Then we request full access under the Federal Health Insurance Portability and Accountability Act. Emily looked out the window. The city lights shimmered like reflections on glass. Her body still ached. But her voice was steadier than it had been in days. Then do it, she said. Let's start. Julia nodded. First, we send a notice to the hospital's legal office. Emily's phone buzzed again. Another message from Cass. Cass also found an internal note from an admin, flagged for deletion in 72 hours if not reviewed. Looks like they're trying to push it through quietly. You're not supposed to know it exists. Emily showed the message to Julia. They're moving fast. Then we move faster. For the first time since waking from surgery, Emily felt like she was regaining control. Piece by piece. One file. One record. One truth at a time. Emily's phone buzzed again. It was the hotel exterior. Julia's car pulled into the courtyard under the dim glow of the street lamps. She watched the headlights play across the window blinds, mingling with the sterile pattern of light that still flickered in her body's memory. She took a deep breath and rose slowly from the bed, muscles aching not just from surgery but from the weight of the days that followed. Opening the door wide, Julia stepped in, carrying a neatly organized folder. No fuss. No overly dramatic gestures. Just purpose. How are you holding up? Julia asked, setting the folder on the desk. Emily didn't answer right away. Her eyes fell to the folder, and she felt a quiet resolve unfurl within her. It had taken too long to get this far. The files Cass unearthed had confirmed the worst. Daniel's d.carter.proxy account had authorized the sterilization. It was wired into the digital audit trail, unshakable even for those trying to cover their tracks. Julia cleared her throat. The law firm I contacted is ready to file a preservation notice first thing in the morning. We just need your approval. Emily nodded slowly. Do it. Julia paused, meeting her eyes. We also need a statement from you. Something factual, emotion-free. What happened, when, and how? Emily sighed. I'll write it in the morning. I'm tired. Julia looked at her thoughtfully. Sleep now. We fight tomorrow. Julia stayed for the night, returning with coffee in the early hours. She'd already drafted notices pushing to preserve all hospital logs connected to Emily's case. The folder on the desk grew weighty with legal documentation, printouts of metadata, timestamps, and screenshots. Emily studied them under the cold light of morning, every line a reminder that her body had been violated, and now, so had her trust. Minutes later, a soft knock at the door startled them both. Neither expected visitors. Julia exchanged a glance with Emily and whispered, "Don't answer." The knock came again, a little firmer. It was Nurse Leah. Emily's muscles tensed. Leah entered, hands trembling slightly, eyes strained. She looked at Julia, then at Emily. "I needed to see you," she said quietly. Emily didn't move. Leah cleared her throat. I've been thinking about what happened. I couldn't live with it." Emily's voice was narrower than she felt. "What do you want, Leah?" Leah swallowed. "I have something you need to know. I tried to get it to Cass earlier, but they're monitoring hospital networks now. I couldn't risk being caught." She pulled out a thick envelope, plain white, unmarked. Inside was a printed report, internal chat logs from the hospital messaging system, detailing exchanges about Emily's surgery plan, how the decision had been presented as necessary right before doors closing for anesthesia. Names like Dr. Warren, Chief Admin Office, and Operation Room Scheduling peppered the log, timestamps showing deliberate planning minutes before surgery. Emily reached out and took the envelopes, her hands shaking. She opened them only enough to see the log lines. Tubes tied as preventive measure, approved per doctor's decree. Consent via proxy chain established. Bypass inpatient proxy block, override. Tears she had held at bay seized her throat. Leah looked at her, voice trembling. I didn't see it until after. I didn't agree to be complicit. I'm so sorry. Emily closed her eyes and let out a breath that felt as heavy as the air in the room. When she opened them again, she saw no malice, only regret. Julia stood and gently took Leah aside. We may need your testimony when this goes to court, she said softly. Leah nodded, more composed. I will do what I can. By midday, they were ready. Julia dressed ready for office. Emily wore clean clothes, carefully chosen, not too tight around the healing wound. Together, they went to a nearby legal clinic, where they handed over files, screenshots, logs, and Leah's envelope to a civil rights attorney who eyed every document with growing intensity. This is substantial, the attorney said, leaning back. Unauthorized sterilization, whether or not it's categorized as malpractice, is also a violation of fundamental bodily autonomy and informed consent. Courts have recognized such procedures without explicit patient approval as assault and battery. She continued, I'll file preliminary motions tonight, one to preserve all digital records, another to compel disclosure of your signed consent form and any proxy overrides. She tapped on a printout. Federal rules mandate a 30-day waiting period before sterilization when federally funded programs are involved, unless it's an emergency. That gap is missing in your chart. Emily stared at the woman. Between Daniel's proxy login, conflict of interest as both spouse and doctor, and the lack of proper consent, the case was more than medical, it was civil rights. Exiting the clinic, Emily breathed deeply. The air felt sharper, clearer. She was still wounded. Still healing. But she was moving forward. At home that evening, she deleted all messages from Daniel unread. The red dot lurked at the top of her phone screen like a threat. She refused to open them. Instead, she wrote her statement. Short. Direct. On July 15 at 7:21 a.m., during my surgery, a second procedure, bilateral salpingectomy, was added under a proxy login belonging to my husband, Dr. Daniel Carter, without my prior or informed consent. I did not sign or authorize any such procedure and was under anesthesia at the time. I discovered this only through digital records. I affirm this account under penalty of perjury. She signed it. Julia printed and notarized the statement before bedtime. Night came. In the quiet, Emily allowed herself to grieve. Not for what she lost in her body, she could face that later, but for what she lost in trust. Julia slept in a separate room. Emily lay awake, letting memories of earlier days drift through, holding Daniel's hand in the corridor, his reassuring smile, the gentle voice she would never trust again. But beneath that grief was something new, a fierce clarity. Tomorrow, she would speak. Tomorrow, justice would start to unfold. The message came the next morning, simple, emotionless, delivered through a court-appointed server. Dr. Daniel Carter is to cease all direct contact with Emily Carter pending further legal review of medical and ethical violations. Order signed and filed under emergency protection. Emily stood in silence as Julia read it aloud. Her hands were cold, but steady. You're protected now, Julia said, setting the document down. At least legally. He can't approach, call, text, email. Nothing. But Emily knew it wouldn't be that simple. Daniel wasn't the type to walk away quietly. He hadn't been before, and he wouldn't be now, not when his carefully managed life was beginning to unravel. She didn't have to wait long. Later that afternoon, her phone rang from an unknown number. She let it go to voicemail. A minute later, another call came from the front desk of the hotel. "There's a man here," the clerk said. "He says he's your husband. He's demanding to see you." Julia took the call from Emily's hands. "Tell him to leave. And if he doesn't, call the police." Then she turned to Emily. "You sure you're ready for this?" Emily didn't hesitate. "I'm not hiding." Within 15 minutes, Daniel was being escorted up by hotel security, not to her room, but to a neutral conference room in the business center. Julia arranged it with the front desk to maintain boundaries, and Emily sat at the head of a small table, waiting, documents beside her. When Daniel entered, he looked thinner, paler. His jaw was tight, eyes ringed in exhaustion. He closed the door behind him and said nothing at first. The tension in the room was suffocating. Emily didn't move. "Sit." He did. "Did you think I wouldn't find out?" she asked, voice low, every syllable etched in steel. "I didn't want this," he said quietly. "Not like this." "But you did want it," she snapped. "You chose it. You accessed my file under a proxy login, Daniel. You forged consent and approved a surgery that would sterilize me. Then you let me wake up and lie there thinking it was just a standard procedure." His hands clenched in his lap. "You were suffering. The endometriosis, the flare-ups, You don't get to make that choice for me. You don't get to play savior while you take away my agency." Her voice sharpened. "You signed away my fertility like it was a line item. Like it was your decision. Your future. Your control." Daniel leaned forward, face strained. "I thought you would come to see it as a kindness." Emily stared at him. "A kindness? You violated me." He flinched. "I don't care how many medical justifications you string together. I don't care if Dr. Warren supported it, or if hospital protocol let it slide because of your badge. You manipulated a system designed to protect patients, and used it to erase me from my own body." Daniel shook his head. "Emily, I love you. I didn't do this to hurt you. But you did hurt me. You destroyed trust. You destroyed us." He opened his mouth, but she raised her hand. "No more speeches. I don't want apologies. I want you to understand something very clearly." She reached into the folder and pulled out a printed copy of the audit log from Cass. "This is proof of what you did. The login. The timestamp. The override. I have the nurse's testimony. I have a legal team preparing a formal case. You're going to be investigated by the hospital, the licensing board, and the state medical ethics board. And I'm going to make sure your name is attached to every record. Every interview. Every headline." Daniel went pale. "You're going to ruin me." "You ruined yourself," she said coldly. He rose from his chair slowly, hands shaking. "Emily, we can fix this. Please. Let's step away from the legal side. Let's just talk, privately." "There's nothing left to fix," she said. "You don't get to rewrite this story with me in it. Not anymore." He stood there for a moment, frozen, like he was trying to reach for the version of her that used to say yes, the one who forgave too quickly. But she was gone. "I'm filing for divorce," Emily said. "Effective immediately. The papers will be sent to your attorney." Daniel's expression broke then. His mask slipped. But he said nothing as he turned and walked out. When the door closed, Emily exhaled. Her body trembled, not from fear but from the force of release. For the first time in weeks, she felt herself beginning to reclaim the pieces that had been taken. Later that night, Julia slid a new folder onto the table. "Press is asking questions. We've had 2 outlets request interviews. I can stall them, or we can go on record with the facts." Emily nodded. "Let's give them the truth." Because the truth was no longer something she was trying to escape. It was her weapon. The media storm didn't erupt overnight, but when it came, it spread with quiet precision, like a fire crawling just beneath the surface of dry ground. The first outlet that contacted Emily was a small local investigative blog known for uncovering medical scandals. Julia had recommended them over the larger networks circling like vultures, hoping for a headline without context. The reporter's name was Andrea Mason, young, meticulous, and deeply familiar with medical ethics cases. She arrived to meet Emily with only a notepad, a recorder, and a promise: no quotes out of context. No publication without approval. The interview lasted 3 hours. Andrea asked questions no one else had thought to ask, not just about what happened in the operating room, but about the days before. The silence. The trust. The erosion of boundaries that Emily hadn't seen until it was too late. When the story finally published, it didn't use her name. Emily had insisted on anonymity for the first wave. The headline read, "Sterilized without consent, how hospital protocols enabled a violation no one questioned." The article was shared more than 10,000 times in its first 24 hours. And buried within it was the truth, backed by documents, expert opinions, and one quote that made it all undeniably real. She entered for a routine appendectomy. She left unable to bear children, and no one told her why. The reaction was swift. The hospital issued a generic statement promising an internal review. Dr. Warren stepped back from his role pending ethical clarification. But no names were officially acknowledged. No apologies were offered. Daniel's profile was quietly removed from the hospital's staff directory. His phone, once incessantly calling, had gone silent. Still, none of that brought closure. Not yet. 3 days after the article dropped, a package arrived at the hotel. It was unmarked, hand-delivered, slipped under the door without so much as a knock. Julia opened it cautiously. Inside was a USB drive. No note. No name. They plugged it into Julia's encrypted laptop. The folder contained only one file, a screen recording. Emily leaned forward as the video played. It was a capture from the hospital's internal scheduling and consent system. The cursor moved through several patient records, stopped on hers. The digital consent form appeared, showing a single checkbox marked appendectomy. Then, the cursor exited. A moment later, a second user logged in, d.carter.proxy. The form was reopened. A new procedure was added manually, bilateral salpingectomy. There was no system prompt. No dual authentication. Just a green confirmation line, procedure accepted. Updated to surgical plan. The timestamp, 7:21 a.m. Emily sat frozen as the recording continued. Another internal message popped up, between Dr. Warren and the scheduler. She's already under. Prep for the second procedure. Then the video ended. Where did this come from? Emily asked. Julia shook her head. Probably someone inside. Maybe Cass. Maybe someone else watching this all unfold. Emily stared at the paused frame. Her name. The override. The quiet finality of the added line. This is the moment it happened, she whispered. Right here. This is when they decided my body wasn't mine anymore. We send this to the attorney, Julia said. Now. They didn't hesitate. The file was uploaded, encrypted, and submitted with an affidavit to the civil rights legal team already handling Emily's case. That evening, while Julia was on the phone with the attorney, Emily received another message. This one wasn't anonymous. It was from Leah. I need to talk. It's worse than you think. Can I come to you? Emily replied, come now. Leah arrived wearing a plain coat, no makeup, her face pale and tired. She stepped into the hotel room and sat on the edge of the chair, looking like she hadn't slept since the day of the surgery. I was pulled into a disciplinary meeting, she said. No specifics, but the tone made it clear. They know I talked to someone. Emily exchanged a glance with Julia, who had returned from the other room. What do you mean worse? Emily asked. Leah looked at her, then lowered her voice. That wasn't the only patient. Silence. Emily's hands clenched. What? There were 3 other women, Leah said. Different procedures, all labeled as preventative. One with a partial hysterectomy. Another with ovarian tissue removal. All marked under emergency consent, but in each case, the patient was sedated. Emily felt nausea rising. How do you know? I checked the system, Leah said. I kept a list. I didn't understand what I was seeing until I saw what happened to you. That's when it clicked. Did they all have someone working at the hospital? Julia asked. Leah nodded. Spouses. Partners. Some had distant connections to the administration. One woman was just listed as high risk, and Dr. Warren overrode her consent form under a medical waiver. Why? Emily asked. Why would they do that? Because they believe it's ethical, Leah said. Warren talks about preventive medicine like it's a crusade. And he enables people like Daniel, men who think they know better. Men who think love is justification for control. Emily stood and walked to the window. The city below looked so normal. So unaffected. We need their names, Julia said. We can reach out. Build a case. This isn't just malpractice anymore. This is systemic. Leah nodded. I'll send what I have. But I can't keep doing this alone. You're not, Emily said. You're with us now. Leah's eyes brimmed with tears, but she held them back. Thank you. As she left, Emily turned to Julia. We're not just fighting for me anymore. Julia nodded. We're going to break this wide open. And for the first time since that surgery, Emily knew, this wasn't just about recovery. It was about exposure. And justice. The tension in the hotel room grew more pointed after Leah's departure. Julia returned to her laptop immediately, forwarding Leah's intel to the legal team and redoubling encryption protocols. Emily, meanwhile, walked to the bathroom mirror and looked at herself for the first time since the surgery with a kind of clinical detachment, eyes rimmed with exhaustion, skin paler than usual, hair tied back in a haphazard knot. She lifted her shirt and gazed at the fading bruises around the bandage lines. The outer wounds were healing. But nothing inside her felt the same. Not her organs. Not her identity. Not her sense of safety. She didn't cry. She hadn't in days. Instead, she sat down, pulled out a pen, and began to list the names Leah had provided. Just 3 at first, each marked by a cryptic timestamp, each falling within the last 8 months. But Julia was right, this was systemic. Not an accident. Not an isolated betrayal. And if the truth didn't come out now, it would be buried beneath polished hospital walls and confidential settlements. Julia returned with a document. We have a formal motion now for emergency injunctive relief. Our lawyers pushing the court to freeze all patient data linked to Dr. Warren, your ex-husband, and 2 other staff members Leah identified. Emily signed without hesitation. That same night, at almost 11, there was a quiet knock at their hotel room door. Julia stood immediately, tense, peering through the peephole. It's her, she said. Leah entered again, this time carrying a folded envelope and a flash drive. They've started deleting entries, she said without even sitting down. One of the women, Kendra Llewellyn, her records were marked for archival at 10:48 tonight. 30 days earlier than standard policy. That's an active concealment attempt. Julia took the flash drive from her hand. You copied the record? All of it, Leah replied. Procedure notes, system messages, and internal communication about the deletion flag. You'll see Dr. Warren's digital ID again. Same tactic. Emergency preventive override. Emily leaned forward. Did Kendra know what happened to her? She thought it was exploratory, Leah said. No one ever told her she was partially sterilized. She's been trying to conceive for 6 months. A cold silence fell over the room. "And the others?" Julia asked. "One reached out to me yesterday after she saw the article. She said she'd noticed discrepancies in her chart too, but the hospital had dismissed them as clerical errors." Emily spoke with measured control. "Are they willing to talk?" Leah nodded. "They're scared. But they're angry." "Then we start building a coalition," Julia said. "We don't need to wait for the hospital to investigate itself. We take this public. Now." Within 24 hours, Emily's team had set up a private, encrypted group chat with the 3 additional women. They were from different cities, different walks of life, but their stories bore identical DNA, minor procedures that resulted in permanent reproductive changes, all filed under necessary preventive measures, all added after sedation. Emily introduced herself first in the chat, not as a victim, but as someone reclaiming ownership of her own story. The women responded slowly at first, hesitantly. Then one message broke the dam. "I knew something was off. But I thought I was crazy." Then another. "They told me my uterus was too damaged. I never saw the consent form." And finally, "Let's take them down." They agreed to appear anonymously in an upcoming feature with Andrea Mason, the same reporter who'd covered Emily's case. With Julia's legal guidance, they were protected, their identities secure for now. But their testimony would make it clear, the pattern was not hypothetical. It was fact. It was real. And it was growing. Meanwhile, the hospital released a short public update. In light of recent allegations regarding consent protocols and post-operative disclosures, St. Grace Memorial has placed several staff members on administrative leave pending independent review. "We remain committed to patient safety and transparency." But Emily knew it wasn't transparency. It was damage control. Dr. Warren hadn't made a public statement. Daniel hadn't been seen since his confrontation with Emily. Rumors swirled internally that legal advisors were already crafting settlements for potential litigants, quietly offering non-disclosure agreements and waivers in exchange for silence. They weren't going to win this in court alone. They would need public pressure. Noise. Andrea's second article published 2 days later. Silenced by surgery, 4 women. 1 hospital. A pattern of consent betrayed. It went viral. National networks picked it up. Medical ethicists began speaking out online. Hashtags trended. Survivors of similar violations in other hospitals began sharing stories. Most had never pursued legal action. Most had been told, repeatedly, that they'd simply misunderstood what happened to them. But the evidence in Emily's case was undeniable. The video. The login trail. The overridden consent form. And now, the coalition. It wasn't just a story anymore. It was a movement. That night, Julia booked a secure Zoom call with a class action attorney based in Washington, D.C. Emily, Leah, and the other 3 women joined the call, each from different rooms, each silent for a long moment as the camera windows connected. Then the attorney spoke. "What you're about to do is historic. Cases like this rarely see the light. But with your courage, and this evidence, we can not only bring justice to those responsible, we can prevent it from happening again." The women listened. Emily's hands trembled under the table, not from fear this time, but from the sheer weight of what was coming next. Not just lawsuits. Reform. Recognition. And the full, unfiltered truth. 2 weeks after Emily's story broke and the movement began gaining national traction, an unassuming email arrived in Julia's encrypted inbox. No sender name. Just an internal-looking address and a subject line that read, "For her eyes only." Julia scanned it quickly, jaw tightening as she read. Then she turned the laptop toward Emily without saying a word. The message was short. "There is a backup. It's not on the main servers. Check the sublevel A storage unit. Archives. Folder name, Preventive Streamline, Phase 1. You'll know what to do with it." Beneath the text was a series of access credentials, most likely copied from a now deactivated admin account. No signature. No threat. Just information, left like breadcrumbs from someone inside. Emily leaned back slowly in her chair. It's real. More than real, Julia said. Someone just gave us the playbook. They didn't wait. By nightfall, they were outside the administrative wing of St. Grace Memorial. Leah had arranged for a back entrance to be unlocked briefly under the guise of after-hours janitorial maintenance. She met them in the corridor near sub-level A, dressed plainly, hair tucked under a knit cap. This isn't the hospital network, Leah explained as they made their way down the sterile concrete hallway. It's a legacy archive, physical backups, digital mirrors stored offline in case of system collapse. Only a few people even know it exists anymore. Emily glanced around. So this is where the things go that they can't scrub. Leah nodded grimly. They passed through a secondary door requiring a key code. Leah typed it in, hesitating only once before hitting enter. The heavy door opened into a long, climate-controlled storage room filled with filing cabinets and outdated digital terminals. Despite the age of the equipment, a low hum vibrated beneath the floor, evidence the servers were still active. There, Leah said, pointing to a black monitor at the far end. Terminal 5. That's the only one with access to the archive. Julia sat down at the monitor and plugged in the access credentials from the anonymous email. The screen flickered, then loaded a bare-bones interface. A directory appeared. Most folders were system backups, dated, labeled by department. But one stood out. Preventive Streamline, Phase 1. Julia opened it. Inside were over 36 subfolders, each tagged with a patient ID, a date, and a secondary tag, adjunctive revision, emergency upgrade, non-consensual override, and most damningly, unnotified sterilization. Emily's breath caught. 37 patients, Julia said slowly. This isn't just about you. Or even the other 3. This goes back years. She opened one folder. A full surgical report populated the screen, alongside internal messages between surgeons, administrators, and digital compliance officers. There were signatures. Authorization stamps. Even embedded comments like, patient unaware. Proceed under silent proxy. Emily read them in silence. Each line was a confession, clinical, calculated, completely detached from humanity. This wasn't a mistake, she whispered. This was protocol. Leah scanned the files over Julia's shoulder. Dr. Warren. Dr. Helms. A few others I don't recognize. And always someone acting as medical proxy. But not one patient consent form. Julia connected an external hard drive and began copying the files. Is it enough? Emily asked. Julia looked at her. It's more than enough. It's systemic conspiracy. Violation of federal informed consent laws. Medical malpractice. Reproductive coercion. You name it. Emily stared at the screen as the files copied. The truth was uglier than even she had imagined. This wasn't a rogue decision by a manipulative husband. It was an institutional failure built on arrogance and indifference, masked as preventive care. They left quietly, locking everything behind them. Leah returned to her shift with no sign she'd ever left the nursing station. Emily and Julia drove in silence until they reached the hotel. Only then did Julia speak. We leak it. Emily turned toward her. Everything? Yes, Julia said. Every folder. Every signature. The public doesn't just deserve outrage, they deserve to understand the scale. Emily took a deep breath, then nodded. Do it. By morning, major outlets were calling. The files had been uploaded to a secure server and sent anonymously to 3 national investigative reporters, all known for exposing institutional corruption. The leak came with no commentary, only the evidence. Within 24 hours, the story broke nationwide. Sterilization protocols at St. Grace Memorial, a decade of violations uncovered. Every network picked it up. Terms like proxy override, digital coercion, and silent sterilization flooded the headlines. Medical boards launched immediate reviews. The Department of Health and Human Services announced a federal investigation. And then came the subpoena. Emily's legal team was contacted by a federal attorney requesting her full testimony. She was to appear, confidentially, for a preliminary hearing on potential civil rights violations in healthcare systems. The invitation wasn't just about her case anymore. It was about setting precedent. Emily sat at the hotel room table the night before the hearing, reading the compiled case files one last time. Each page carried the weight of someone else's loss, people who didn't know they'd been violated until now. People who might never have known at all. She picked up a photo from the folder, a printout of the audit log with Daniel's proxy login. She stared at it without flinching. "Are you ready?" Julia asked gently. Emily nodded. "I don't want to be someone this happened to anymore." Julia smiled softly. "Tomorrow, you won't be." The next day, Emily walked into the courthouse. Not as a patient. Not as a victim. But as a witness. A woman who had been silenced, and was now making sure no one ever would be again. The courthouse waiting room was quiet, unadorned, and cold in that uniquely bureaucratic way. Emily sat on a narrow bench outside the hearing chamber, a folder balanced on her knees. Inside it was her written testimony, her ID, and an indexed record of the digital evidence now being used to shape one of the most high-profile medical ethics cases in recent history. Julia stood nearby, arms folded tightly, watching every movement of the security personnel and court clerks as if they were potential threats. She didn't speak. She didn't need to. Emily's silence was enough to fill the room. A federal aide finally stepped out. "Ms. Carter, they're ready for you." The chamber was intimate, not the dramatic arena most imagined when thinking of court. 3 federal legal examiners sat behind a long wooden desk, each with laptops, documents, and nameplates. This wasn't a trial, yet, but a closed-door evidentiary session to determine whether the Department of Health and Human Services would formally pursue legal action against St. Grace Memorial and its administrators. Emily took her seat across from them. "Ms. Carter," the lead examiner said, a middle-aged woman with a calm, clipped tone. "Thank you for being here. Please be advised you are under oath and protected under federal whistleblower statutes. Do you understand?" "I do," Emily replied. The questions began. They asked about the date of her procedure. The circumstances leading up to her hospital admission. The name of the surgeon. The timing of the unauthorized procedure. Emily answered each one clearly, without emotion. Her voice didn't waver, even when she described waking up in recovery and discovering what had been taken from her. What she had never agreed to. What she had never even been asked about. They moved on to the system audit trail. To the video screen recording. To the digital proxy login used under Daniel's name. "Did your husband discuss the procedure with you at any time prior to surgery?" the examiner asked. "No." "Did you authorize him, in writing or verbally, to act as your medical proxy?" "No." "Was there any indication, medical or otherwise, that the second procedure was necessary to address an immediate, life-threatening situation?" "No." "Did you receive any counseling or informed consent documentation regarding sterilization in the days or weeks before your surgery?" "No." "And you did not sign a second consent form?" "I did not." Each answer landed like a stone. The examiners exchanged looks. One of them typed notes rapidly. Another leaned forward. "Ms. Carter, our records indicate that St. Grace Memorial has issued a statement claiming that the procedure performed on you was under an internal protocol labeled Preventive Reproductive Safeguard. Are you familiar with this term?" "No. It was never explained to me. I read that phrase for the first time in a newspaper article quoting their press office." "And what is your understanding of that protocol now?" Emily's eyes narrowed. "It's a smokescreen. A way to justify taking control over a woman's body without her consent. Dressed up as medical benevolence." A long silence followed. Then, Do you believe other women experienced the same violation under that protocol? Yes. You've made contact with them? Yes. For so far. But there are more. Another examiner nodded slowly. Thank you, Ms. Carter. Your cooperation is invaluable. After she left the chamber, Julia was waiting for her in the hallway. Emily exhaled slowly. That was the easy part, Julia said. Now we see how far they're willing to take it. And it didn't take long. By the end of that week, federal subpoenas were issued to St. Grace Memorial. The hospital's general counsel responded with a surprising maneuver, publicly distancing the institution from Daniel and Dr. Warren. In a carefully worded statement delivered during a press conference, the spokesperson said, "We acknowledge that improper actions may have occurred under the direction of certain staff members acting without appropriate oversight. While the institution did not authorize any deviation from consent policies, we are cooperating fully with the investigation. It was a surgical deflection. They were preparing to sacrifice Daniel and Warren to shield the hospital. And it worked. Temporarily." Media outlets began reporting that Daniel Carter and Dr. Warren were likely to face personal criminal charges. The headlines shifted from systemic failure to rogue practitioners. The public's attention, once focused on the entire institution, now funneled down to two individuals. Emily watched it unfold from the hotel television, her jaw clenched. "They're trying to spin it," Julia said. "They'll admit the truth, but only in pieces. Enough to placate the public. Not enough to destroy the hospital's reputation." Emily stood. "Then we force the rest into the light." They returned to Andrea Mason. In her next report, Andrea published direct excerpts from the leaked Preventive Streamline folder. But this time, she named the hospital, not just the doctors. The article included screenshots of internal memos with St. Grace Memorial's digital compliance officers approving changes to patient records and proxy protocols. It showed the institution knew. And then came the real twist. One of the screenshots revealed a name Emily hadn't seen before, Dr. Felicia Rice. She had been a consultant for St. Grace Memorial's ethics board during the period the protocol was active. And next to her name, on a forwarded email, was a short sentence. If the patient is married to a staff physician, their proxy consent should be considered elevated under joint care assumptions. Emily stared at the line. That's the foundation. That's what they used to justify it. Julia nodded slowly. They built a whole policy around presumed marital consent. Andrea's article included that line. She quoted legal experts who described it as a grotesque perversion of patient autonomy. Public outrage reignited, now broader and louder than before. In response, Dr. Rice issued a personal statement claiming she had been misinterpreted and that the policy was a misapplication of her internal advisory. But the damage was done. The Department of Health and Human Services officially announced a full-scale federal review of St. Grace Memorial and its affiliated surgical ethics programs. Medical boards in 3 states launched independent audits. And then the lawsuits began. It started with Emily's. But quickly, 4 more women joined. Then 6. Then 11. A class action was formed. Emily sat beside Julia and the attorney who now led the coalition, watching as the docket was filed. The cover page read, "Carter vs. St. Grace Memorial and affiliated parties." She closed her eyes for a moment, then opened them. This wasn't revenge. This was accountability. And it was only just beginning. The weeks that followed the class action filing were unlike anything Emily had experienced before. Her name, once confined to court documents and encrypted messages, now echoed through the public sphere. Overnight, she became more than a witness, she became a symbol. And with that came a pressure she hadn't expected, a burden that only grew heavier as more women stepped forward. The courthouse was flooded with press every time a motion was filed. Julia managed media relations with precision, filtering interview requests and negotiating with advocacy organizations that wanted Emily to speak at conferences, on panels, in front of cameras. But Emily's world had narrowed, not expanded. she spent most days in a borrowed office in her attorney's firm, reviewing statements, clarifying records, and writing replies to letters that poured in, some full of gratitude, others filled with vitriol. The backlash was fierce. Not just from strangers on the internet who claimed she was exaggerating or politically motivated, but from former acquaintances. Even medical professionals she had once trusted posted veiled comments online about the complexity of consent in emotionally charged cases. Others said nothing at all, and their silence roared loudest. But it wasn't just public scrutiny Emily faced, it was personal. One afternoon, Julia handed her an envelope forwarded through their legal firm. Emily hesitated before opening it. Inside was a handwritten letter from Daniel. It wasn't long. No legal language. Just a page torn from what looked like a journal. I never imagined it would come to this. I thought I was protecting you. I thought I was saving us from something you didn't want to face. I never meant to hurt you. But I see now that I did. And maybe you'll never forgive me, but I needed you to know, I still love you. Emily read it once. Then again. And then tore it in half. She said nothing about it for the rest of the day. She didn't need to. Julia understood. There was no space for apologies anymore. No room left for intentions. Only consequences. Despite the chaos, Emily pushed forward. She began attending survivor support group sessions online, anonymously at first, using a pseudonym. But word got out. Soon, she was asked to lead. At first, she resisted. She didn't see herself as someone others could lean on. Until one evening, after a particularly emotional session, a young woman sent her a private message. You gave me the words I didn't have. Thank you for saying what I couldn't. That night, Emily wrote a speech. Not for a courtroom. Not for a news camera. But for the women like that, quiet voices, buried by shame and confusion and institutional silence. Her first public appearance came 3 weeks later at a National Women's Health Summit in Boston. The conference hall was packed. Journalists lined the back row. The stage lights were hot and direct. She stood behind the podium, heart thudding, fingers wrapped tightly around the paper she had rewritten 6 times. I never imagined my name would become a headline. Or that something done to me without my knowledge would lead me here. But I know now that what happened wasn't just an accident. It wasn't a tragic miscommunication. It was the product of a system that believed it could decide for me. They said they were protecting me. But protection without permission is not safety. It's control. I stand here not just for myself, but for every woman who was never told. Never asked. Never believed. This isn't just my story. It's ours. And we're not going to be quiet anymore. When she finished, the applause didn't erupt like in movies. It rose slowly, as if people were digesting something too heavy to immediately cheer. But then it built, and it didn't stop. Emily stood still, letting it wash over her, not as a triumph, but as a reckoning. Afterward, reporters approached, flanked by camera crews. Julia handled most of the interactions, but one question slipped through to Emily as she exited the venue. Do you see yourself as a victim or an activist now? Emily paused, met the reporter's eyes. I see myself as someone who survived something that never should have happened, and who's making sure it never happens again. The next morning, the article was front-page news. Not just in local media, but in national health policy journals. Editorials debated the future of consent protocols. Medical schools began revisiting their ethics curriculums. And in response to growing pressure, the American Medical Association released a statement. No procedure, no matter how clinically sound, can ethically proceed without informed, documented, and non-coerced consent from the patient. We condemn any systemic deviation from this standard. It was a small victory, but a public one. The tide had begun to turn. Still, with every win came another wave of resistance. St. Grace Memorial filed a motion to dismiss several plaintiffs from the class action, citing procedural ambiguity. Their attorneys claimed that medical proxy use was a good faith interpretation of complex cases. They argued that no one had been intentionally harmed. Emily read the filing and felt something she hadn't felt in weeks, pure, undiluted fury. So she answered it herself. With Julia's help, she wrote a public response that was published as an op-ed in the New York Times. I was sterilized without my consent. Here's why that language matters. In it, she dismantled every word of the hospital's defense, not as a lawyer, but as a woman who had lived through the consequences. She explained how language like ambiguity and good faith was used to obscure power. How silence was rebranded as permission. How systems used complexity as a weapon. The response was overwhelming. Senators called for hearings. State legislatures began reviewing their consent laws. Activist groups mobilized. The class action swelled to 18 women. But amidst it all, Emily remained grounded, not in revenge, but in purpose. One night, while walking alone through the city near her hotel, she passed by a maternity center. She stopped at the window. Inside, a nurse cradled a newborn while the mother slept. The baby's fingers curled tightly around the blanket. Emily didn't look away. She allowed herself to feel the ache, the permanent change, the life she would never hold because of a decision made without her voice. But she didn't let it break her. Instead, she whispered into the night, not with sorrow, but with strength, not again. And kept walking. 6 months after the day Emily Carter had entered the operating room for a routine appendectomy, she stood backstage at the International Summit on Medical Ethics in Chicago. The hall beyond the curtain was filled with clinicians, researchers, legal scholars, and advocates from around the world. Her name had become more than familiar in those circles. It had become a case study, a symbol, and, for many, a call to action. The event's host, a physician known for his work in bioethics reform, approached her with a tablet in hand. "You're on in 5, he said. "Just a heads up, the Surgeon General is in the front row." Emily gave a small nod. She wasn't intimidated. Not anymore. Behind her, Julia stood with her arms crossed, eyes scanning the crowd with her usual blend of suspicion and strategic calm. Their attorney, now representing over 24 women in the class action, was seated near the stage entrance. Leah had flown in that morning, accompanied by another nurse who had joined the growing list of whistleblowers. The weight of the movement they had built stood beside Emily in silence, not needing words. When the lights dimmed and the music faded, the announcer's voice echoed through the hall. "Please welcome Emily Carter, plaintiff, advocate, and voice for informed medical consent worldwide." She stepped into the light. The applause was immediate. Thunderous. She let it roll over her, not as validation, but as fuel. When it finally quieted, she approached the podium, unfolded a single page of notes, and began to speak. "I am not a doctor. I'm not a lawyer. I'm not a politician or an academic. I'm just a woman who walked into a hospital trusting the people I loved, and woke up changed forever, without my permission." No one moved. No one whispered. The silence was total. My story is not unique. And that is what makes it terrifying. We are taught that medicine is rooted in trust, that our bodies are our own, that consent is sacred. But I learned that under the right conditions, and with the wrong people, those principles are treated as optional. She paused, letting the weight of that truth settle. In the months since I came forward, I have met women who were silenced before they even knew what happened to them. I've seen documents hidden, records erased, signatures forged, and systems designed not to protect patients, but to protect institutions. Emily's hands did not shake. Her voice did not waver. This isn't about one hospital. Or one doctor. Or even one law. It's about a culture, one that too often believes that women's pain is secondary, that women's choices are negotiable, that the people who love them know better than they do. That culture doesn't belong in a clinic. It doesn't belong in a surgical suite. And it definitely doesn't belong in the future of medicine. She paused again. The front row, surgeons, educators, policymakers, leaned forward. I am not here today because I want to relive my story. I'm here because I want to prevent yours. Her voice sharpened. I want to see every medical school in the country make explicit, ongoing, and unflinching education on consent. I want laws that don't leave room for interpretation when it comes to reproductive autonomy. I want digital systems that cannot be bypassed by a proxy without a verifiable, time-stamped, two-factor confirmation from the patient. And I want to see accountability, not only for those who break the rules, but for those who build systems that make it possible. The applause started before she even finished her next sentence. I cannot change what was done to me. But I can make sure it never happens to another woman. The room stood in unison. Not just applause, solidarity. Every face was turned toward her, not in pity, but in respect. After she left the stage, cameras followed her into the wings. Journalists called her name. But she ignored them. She went straight to Julia and hugged her. You did it, Julia said. No, Emily replied. We did. Later that evening, in a closed session with legislators and public health officials, Emily reviewed a draft of the bill being shaped directly from her case, the Federal Informed Consent and Surgical Accountability Act. It included mandatory third-party consent verification for all sterilization procedures, heightened restrictions on proxy override use, and federal funding for consent education in underserved communities. It was a beginning. In the coming weeks, new headlines emerged. St. Grace Memorial settles with victims in historic multi-million-dollar case. Dr. Warren faces criminal charges in coercive surgical practices. Medical proxy law reform gains bipartisan support. Daniel Carter, stripped of his license, disappeared from public view. Emily never saw him again, not in court, not in the press, not even in passing. It was better that way. But what remained, what truly mattered, was the shift. Across the country, hospitals revised their protocols. Patient advocacy groups multiplied. Lawmakers introduced similar bills in over a dozen states. And Emily went home. Her real home. Not the hotel. Not a courtroom. A small apartment on the edge of town where she could finally breathe again without waiting for another blow. She decorated it slowly. Chose every piece of furniture herself. Reclaimed her space. One morning, as sunlight broke across the kitchen floor, she opened a letter. Handwritten. From one of the women in the class action. It ended with a line Emily would never forget. You didn't just fight for justice. You fought for our dignity. And you won. Emily placed the letter beside her bed, next to the small bronze plaque she had received from the summit. It read, one you never consented to, but one you reclaimed. She smiled, not because everything had been healed, but because everything had changed. And this time, on her terms.